cholera epidemic we currently have that is already taking lives, those organisms, when there is open defecation, they get passed into the environment. Rain falls, washes it into the water bodies, and such water can flow from River Niger to all the tributaries, or River Benue into River Benue and to all the tributaries. I just use those rivers, those big rivers, as an example, that wherever this contamination of water happens, it can get into bigger water bodies and also get into smaller bodies. So if it's happening in Sokoto today or in Niger State where it has been reported, it can potentially spread to the entire country just through rainfall and the river, that gets in. So primary prevention is key through education, clean environment, and also prompt response at the local level.
A high number of cholera cases have been reported in Nigeria from January till date, with 6 northern states currently battling with the disease. In the past, cholera infections were common in many countries around the world, but they are now confined to developing regions because the disease is associated with poor nutrition, poor water, and a poor environment. In African countries, especially in Nigeria, a larger number of people died of cholera infection in 1991, 2010, 2014, and 2018. It is mostly believed that cholera, an acute diarrheal disease caused by Vibrio cholera bacteria, is a disease of poverty. It is also believed that living in rural areas promotes it as a social risk factor and plays a significant role in its transmission. People get infected through contaminated food, drinks, and generally unhygienic environments, causing serious dehydration. Cholera can lead to death if the illness is not immediately treated with oral rehydration. In an exclusive interview with a medical expert, Dr. Laz Eze gave a detailed explanation of how cholera disease can be contracted.
Cholera is simply caused by a dirty environment. Yes, it's one of those health conditions, one of those diseases you pick from the environment. Of course, the causal organism is Vibrio cholerae, is a bacteria, that causes cholera. When it gets into the body from contaminated water or food, and it gets into the body, it goes to the large intestine. Some toxins from that bacteria, of course, alters the gastrointestinal system and makes it unable for the body to absorb water, and passage of watery stool is of course one of the major symptoms, and of course leading to death if there is no action that is taken within a short while.
The Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu, on Saturday the 10th of July 2021 said between January to June, a total of 14,343 suspected cases of cholera were reported from 15 states and the FCT, recording 325 deaths. States affected include Benue, Delta, Zamfara, Gombe, Bayelsa, Kogi, Sokoto, Bauchi, Kano, Kaduna, Plateau, Kebbi, Cross River, Nasarawa, Niger, and the FCT. The FCT Minister, Bello Muhammad, had earlier raised alarm in a statement released on Friday by his Senior Special Assistant on Media, Sani Abubakar, that the FCT had recorded 514 suspected cases of cholera, adding that preventive measures are being taken to curtail the disease and those affected would be given the high level of care. Eze, who had earlier stated that cholera infections are mostly contracted when people eat or drink something that is contaminated, poor personal and environmental hygiene, further mentioned how it can be prevented and cured.
It's clean food. 3, clean environment. Of course, when our environment is clean and we get food from it, and also get water, potable water, clean drinking water, so there's zero chance of having the organism get into our body. Of course, we know that it's not every part of the country that has access to clean water. It should be a number one priority, because the number of lives that get lost can be replaced. especially children and even adults. Cholera can actually kill anyone, so we need to up our game in terms of health education, strengthening primary health care. Primary health care is not just about the building where people go to receive service. There is a huge community component of primary health care. Health education is a major function of primary health care. We don't have it. So at community level, especially during rainy season, people should be taught to heat their water to boiling level, use a sieve to sieve off any solute before they drink. So even if they fetch it from the stream or from any other place, before any water they are meant to drink, they should heat it, they should boil it, allow it to cool, before they drink it. With that, any organism that might cause any of the diarrhea diseases, including cholera, will be killed. Even worms will also be killed, and they can be saved. The same with food. We should wash it properly with clean water. So even when you have good vegetables, fruits and all that, and you use a contaminated water to wash it, you can still get cholera or any other diarrhea disease that can cause dysentery or even worms.
With the cholera epidemic that is currently claiming lives, efforts have been made by the government to control the disease, as the Nigeria Center for Disease Control had conducted a health education campaign, Emergency Operational Center coordinated national response, and also supported states to ensure a rapid and effective response to the current outbreak. UNICEF has also promoted chlorination of water amongst communities affected by the disease, especially in Borno, Adamawa, and Yobe states. The DG of the NCDC also advised Nigerians to boil and store water in clean and safe containers before drinking, wash their hands frequently with soap and running water so as to prevent diseases like cholera. But with the increase in the number of cases of cholera in the country, there is still much to be done by the government since it hasn't been conquered completely.
Primary prevention is key through education, clean environment, and also prompt response at the local level. NCDC, of course, controls the response and surveillance at the federal level, but the actual response is at the community level, and every community should ensure that they have the capacity to prevent it, and should it happen, respond to it promptly.